China is further optimizing COVID-19 response with 10 new measures announced last Wednesday. According to the Chinese State Council, the new measures are more science-based and targeted in carrying out nucleic acid testing, home quarantine, and minimum restrictions in high-risk areas. In the meantime, measures vary from city to city. Beijing announced on the same day that entry restrictions to the Chinese capital will be lifted, but strict protection measures are still in place in certain crowded indoor spaces, such as restaurants, and places with a concentration of vulnerable groups, such as nursing homes. Why is that? How big is the economy a consideration, and what do we expect for businesses and visitors who have been yearning for cross-border mobility for 3 long years? I talked to Naijun, Associate Professor of the School of Public Policy and Management at the University of the Chinese Academy of Sciences, to get his perspective. Professor Hu, welcome to The Point. On the evening of December the 7th, Wednesday, the municipality of Beijing gave a very important press conference announcing the latest 10 guidelines guiding Beijing's efforts to fight the COVID-19 pandemic in the foreseeable future. It further relaxed certain measures, although still keeping some restrictions in place for places that may be overcrowded. But one of the most important and eye-catching item is the announcement that entry restrictions to Beijing will be lifted. People will not be required to show their health code upon entering Beijing, and they don't have to go through 3 times nucleic acid test over the next 3 days upon arrival. How do you look at this particular guideline? What is the significance, and why announcing it now?
Well, I think Beijing's policy is definitely on the foundation of the national new 10 items of guidelines. So it was yesterday the national mechanism has announced that the national policy has changed. So Beijing will follow up. That's how it works. So Beijing's new 10 guidelines is on the basis of the national 10 guidelines. So that is quite clear.
But it's stricter. It's slightly more strict than the national level guidelines. Why?
I made a little comparisons. Generally speaking, the 9 guidelines are more or less the same, but only, for example, if you want to eat in Beijing's restaurant, you still have to show your health code, and you still have to scan the health code. But from the national guidelines point of view, there's no such things as this to show health code when you are going to eat in. So I think in some the so-called interim places, Beijing is, in my opinion, have something to consider.
Why is Beijing relaxing the entry restrictions?
Right now, the Beijing situation is the domestic infections within Beijing is more serious than the external input, because other cities a lot of cities and regions are not facing the same situations as Beijing. For example, I have mentioned in Shanghai there are only several cases a day from social point of from the social newly committed. So I think the input pressure is not as it is now inside Beijing. So that's why that is to say Beijing do not have to have a very strict restrictions of entering in Beijing. Their focus is on what is happening inside Beijing. So that is why I think Beijing has lifted all the restrictions of entry to Beijing.
Is there an economic point of view, considering the reasons why they're doing this? Because the economy, although over the past 5 years, China has been able to maintain a reasonably high GDP growth, but the fluctuation has been very hard, very big, especially when Omicron became prevalent. And the economy has been under enormous pressure, especially in certain sectors, such as the tourism, such as restaurants, I mean. So is there an economic consideration behind this relaxation on travel within Beijing and out of Beijing?
Well, I think a lot of measures must be taken into considerations. Economic one is, in my opinion, must a priority. In my opinion, more important is the Omicron virus itself. The death rate, the infections rate, and the people with serious symptoms are much less than its original virus and the Delta virus. That is why China and Beijing can have, in my opinion, much less restricted policies. But in my opinion, from the economics point of view, from generally speaking, the economy in China in the last 3 years is, in my opinion, not very bad. We had achieved a relatively medium growth rate, and from the prospections of future, we still have an expectation of about 4 to 5% of growth of GDP. But that just as you have mentioned, some sectors, for example, the flight companies, the traveling sectors, the restaurants, and some kind of entertainment restaurant sectors were hit very much. And Beijing is famous for its travel and tourism. That is why Beijing, in my opinion, has to lift out all the restrictions of entry to attract more people to travel to Beijing, to enjoy the tourism industry in Beijing.
What is the implication for the world of such kind of initiative? Do you foresee Beijing slowly enlarge the sectors that may be opened?
Well, I think it's still very difficult to say the exact date that China and Beijing will be completely back to normal and open to the outside because of the uncertainty of the variations of the virus. So I think if we want to have a relatively certain date or signal, we can expect the WHO's announcement. Because during the last several months, we can see the WHO, in my opinion, is growing very optimistic about the future. The recent announcement from WHO is showing that we are very close to the date that we can say COVID-19 will not be a global pandemic and a threat to the human being. So I think in the near future, on the one hand, we have to see the virus variations trends, whether there will be new trends or new variants that is killing people. And on the other hand, we have to see the new measures of the new 10 guidelines, because the policy will be implemented nationwide. And we will have to see what will be the result. So I think we are not in a hurry to completely open the border to the outside world. We have to wait.
But businesses are in a hurry, including domestic businesses who do foreign trade, who needs to travel abroad, and foreign businesses who need to, or foreign visitors in general who want to come to China, who need to come to China. They are in a hurry. So what can they expect over the next months, let's say? When will China really open as, before the pandemic started?
Well, I think we can't say that we are zero open or we are completely 100% open. We can't select from these two extreme sides. We have to be in the middle way. We have to be cautious and we have to slowly open. That we can't achieve a 100% open in a day's time. But I think in the next half year, we will be more and more open to the outside. Both.
Why not? People would ask, why not open more quickly? Why not? Because the economy clearly, or at least certain sector, have suffered tremendously, and unemployment rate, especially among young people, have been very high.
Well, I think on the one hand is the infection rate in Beijing is still very high. We still have thousands of people who are infected every day. On the other side is the death rate, the people with serious symptoms rate are going down, but it is still a kind of virus. We don't want to be infected. Everybody don't want to be infected. Don't want to be infected. If a majority of people in a certain sector are infected, then this sector will suffer even more. So I think if we can keep a lower infection rate, that is good to a certain sector. We can have a sector to grow and at the same time to have prevention and control measures that have been proved right in the last 3 years. So I think right now we shouldn't say that we will make everything like 2020s. We have to be a little more open than it used to be, but we can't be 100% open. And under the situations like this, we have prevention and control. And at the same time, we can have some sectors to develop. For example, the traveling sector, the tourism sector.
Looking back, how do you assess the Chinese policies in general, from very, very strict, fighting all out with all our efforts to kill the virus, to stem the spread of the virus, to a dynamic zero, and now to a softer policy? We don't know the name yet, but still they're trying to keep infection as low as possible, or keep the period of time longer that people get infected. Looking back at the past 3 years, how would you evaluate, considering the impact on the economy?
Well, we can use some words to describe the general situations of China's prevention and control policy. The most important words are scientific and accurate. For example, just as you have mentioned, why China has taken softer measures yesterday? Because of the situations in Guangzhou. And we can say in Guangzhou, there are more than millions of people who are infected. Not exactly, about 0.16 million people are infected. And in the majority, about more than 90% of them are without any symptoms. So I think under this situation in Guangzhou like this, people can, and China's policy can change from the dynamic zero to it is right now. So I think we are more scientific. And from the accuracy point of view, as we have mentioned, we used to lock down the whole community last year if there is a single case in the community. But in this year, from now on, we can only lock down certain level of floors, certain units. We will not lock down the whole community. So I think this kind of progress, we can use the word like scientific and accurate. And in the near future, I think China will become more and more scientific and accurate. And finally, I don't think there will be a certain date to mark the end of prevention and control. People will come back to normal without any conscience because we are more scientific and accurate.
So what, if I asked you, if you can, what is the experience or lesson that can be drawn from the past 3 years?
Well, I think there are so many things we can learn from the last 3 years, but in my opinion, I think we should
have the most important.
Yes, the most important thing is I would like to say from the supplies point of view, that is to say the healthcare sector. If we compare with UK, the US, European countries, they have this kind of primary level care and secondary care level. But in China, we have to rely on the hospital level. That is the so-called secondary healthcare level in these countries to fight against COVID. But our community, the primary care level, the GPs, the general practitioners, are still need to be developed in China. We need to have a very strong grassroots, the first level healthcare prevention and control in the near future before we can deal with the new kind of virus, maybe in the future.
All right, thank you very much, Professor Naijun from the University of Chinese Academy of the Sciences. Thank you.